Good afternoon to you all. Thank you again for joining this particular lecture on the current practices in monitoring and evaluation of reproductive health. We looked at quite a lot of issues the last time we were here, among which included the key definitions and the purposes, but also we were able to have majority of us share practical or field experiences that they have had in terms of the different frameworks, but also the different approaches that they have had in monitoring and evaluation. But also we ended up looking at some of the current but modern data collection methods, not only specific to reproductive health, but also the ones that are specific to other fields of study, including nutrition, including businesses, regarding how the advances in terms of data collection have come since this particular trend came in. So I think we're able to look at some of the interfaces or some of the databases that countries are using, and use case studies to be able to understand the current but also the practical aspect of the application of these M&E practices. So today we want to look at this. We want to look at the key indicators in reproductive health monitoring and management, monitoring and evaluation. So we're saying that indicators are very essential as they provide measurable ways to assess the success of a program. So in reproductive health as well as in any other nutrition related or any other field, we have indicators that are grouped, and they are grouped in the results chain, where we have the inputs, where we have the outputs, where we have the outcomes and the impacts. So the same way you are able to see the results framework in monitoring and evaluation, you should be as well able to define your indicators in whatever field that you're operating in. You should be able to define your indicators in that level. So here in reproductive health, we can say we have input indicators where we measure the resources that are available for the program, such as the number of contraceptives available or the number of health workers that have been trained. So even if you're looking at in different fields, then you should be able to look at what are the inputs in your health facility. If your interest is to improve maternal, to reduce the number of maternal deaths, then you should be able to look at the input indicator, such as recruiting either a doctor who can do the surgeries and so forth. So those are some of the input indicators. In other words, what you're making available for that particular program. Then we go to the output indicator that focuses on the immediate results of program activities. For example, how many women receive family planning consultations, or how many pregnant women attended ANC. But also you can look at other indicators such as the number of attendances in ANC 1, ANC 2, or any other, according to the way you want to rate the quality of your program. So in other words, if we are doing, if you wanted to do an M&E, say as Resto University, regarding the quality of probably performances that we have, we can look at the input indicators and say probably number of staff who have been recruited. Then we look at a number of the different marketing tools that have been have been put or have been spread around. Then you come and look at the output indicators and look at now the number of staff delivering these lectures, the number of students that have enrolled. So these are the output indicators that we expect immediately as a result of an activity. Then you would then look at the outcome indicators, where you're looking at you're looking at the long-term changes that result from these activities, such as the increase in contraceptive use or the reduction in the maternal mortality rate. So there are certain statements such as immediate outcome, then long-term outcome. Those may not be definitions that are concrete to a particular program, but these are definitions that you can be able to define according to the range of program that you want. So in your program, if you're looking at, for example, in this regard, if you're looking at increase in contraceptive use or reduction in the maternal mortality rate, before you look at the reduction in maternal mortality rate, probably there is an immediate outcome that you would want to look at. So you will just define that particular immediate outcome according to your program design, or how you intend to, what you intend to achieve within that short time there. So finally, we have the impact indicator that measures the ultimate goal of a program. For instance, there has been a reduction in maternal mortality in the target population. Has the rate of adolescent pregnancies decreased, or it has not decreased? So, in other words, where you have your output, where, for example, you're saying that there is an increase in contraceptive use, or there is a reduction in maternal mortality. Then, when you're tracking your impact indicator, you're now looking at in the general population, where there is a reduction in the maternal mortality in the population, or has the rate of adolescent pregnancies decreased? If your impact or if your ultimate goal was to reduce the number of adolescent pregnancies in a community X. So that is how you use the results framework to be able to develop specific indicators by every stage. So these indicators are indeed critical for assessing the true effectiveness of reproductive health interventions. But like I've said in all the statements, we're not only looking at application in the reproductive health services, we're looking at multidimensional sectors. So the same indicators can be still applied in agriculture, can still be applied in trade, can still be applied in all other sectors that are within the context, and you're able to define them per that particular context. So, for example, in India, when you're tracking indicators such as antenatal care visits and skilled birth attendance, then you're able to improve maternal outcomes by ensuring more women receive timely care during pregnancy. So, in other words, if you're tracking an output indicator such as antenatal care visits or skilled birth attendance, then you'll be able to know that if women are attending ANC visits timely, or they are having skilled birth attendances, then your ultimate goal of more women who are of reduced maternal mortality, or the deaths within the health facility, or within that context that you're working around with, the indicators help you track that there is timely care. For example, if you start tracking how many women are coming for this number of visits, then you will ultimately know these ones are not coming, and therefore the intervention will be that your service intervention is not effective, and therefore you need to go to the drawing board and understand that here that using these indicators or this specific result chain stage tracking of indicators will help you and ensure that more women are able to timely care during the pregnancies. So, what are some of the challenges in monitoring and evaluation, especially of reproductive health services or interventions? So, despite the progress made in modern monitoring and evaluation practices, there are significant challenges that remain. And one of them is the data quality issues, which are a very big concern in health programs, particularly in resource constrained but also rural settings. And you realize that health workers most times fail to report data consistently, or the data might be inaccurate or incomplete. We have these cases where someone, for those who are using the antenatal care books or the HMIS antenatal care, realize that someone will write that this mother came, and then write the names of the person who came, writes for even the writes even for you where the person comes from, and fails to complete the information on which visit, or because the health worker is having very many clients, decide that he's going to fill the details later and first do what? And first handle the clients. So at the end, they will just cook the information about these patients. That is why we're saying that our reproductive health monitoring and evaluation still has challenges regarding the accuracy of information or data. And for instance, in Tanzania, the gaps in data reporting have made it very difficult to track maternal deaths accurately, leading to missed opportunities for timely intervention. So, because most times people struggle to report information, you realize that sometimes this client that has come to your health facility for delivery, the history of the client was wrongly recorded, and therefore for you to track this patient most times is very hard. And these are patients that might be having underlying conditions, and because there is inaccuracy in the information, you are unable to do a timely intervention. But also, you then cannot track the intervention that you're having. So you might be thinking that you want to track the maternal deaths, but because there is inadequate information regarding even where the death has occurred, what type or where, it might be hard for you to be able to track these kind of indicators. But also we have cultural and social barriers that are a challenge in our M&E. So they play a very crucial role in complicating data collection. In some parts of the world, reproductive health, especially family planning and the sexual health, are sensitive topics, especially in the African tradition. And therefore, women may be unwilling to discuss their contraceptive views or societal norms that may discourage young people from accessing reproductive health information. So because of our cultural beliefs, but also our cultural constraints, sometimes then you're unable to get key information from this person. So this is what affects, that is how cultural norms and barriers affect reproductive health monitoring and evaluation. And finally, we have resource constraints that are persistent issues, and many low-income countries face severe limitations in funding for monitoring and evaluation activities, which therefore impacts the ability to collect, analyze, and use data effectively. We are giving here an example of Mozambique, for example, that they have struggled with lack of trained monitoring and evaluation personnel, therefore leading to gaps in data quality and reporting. So these three main causes that we have just bundled up, so that you as a researcher, you can go and look again and understand some of the challenges regarding current M&E practices. And you're able to come up with many other challenges that might come around. But when we're talking about resources, then we are talking about personnel, human personnel, we're talking about financial resources and so forth. That's why we decided to bundle them up so that you easily understand. So we want to do a case study in effective M&E. What has worked? Where has it worked? Or how has it worked out? And that is why we have case studies here that I want us to look through. So let's explore some success stories that highlight the impact of effective monitoring and evaluation in health. And in this case, we have an example of Kenya, where they used the mobile health initiative that sent SMS reminders to new mothers, encouraging them to attend postpartum care and family planning consultation. So this simple intervention led to a 30% increase in the uptake of postpartum family planning services, demonstrating the power of mobile technology in enhancing reproductive health outcomes. So as young demographers or as young students and specialists in reproductive health, we're trying to show you here that actually there are certain monitoring and evaluation interventions that have been carried out, and we reap success in them. So you realize that because these people were tracking the number of mothers they have, they are able to generate a system that reminds these mothers to come back for postpartum care. And then you're able to see that because of this activity, actually, there was an increase in the uptake of postpartum family planning services. So it is ideal that because they were probably tracking and using different M&E approaches, they were able to understand some of the challenges that the new mothers were facing regarding the attendance of postpartum care. And because you're able to understand what your clients are saying, then you're able to design an effective measure. And I can just imagine that probably the clients were saying that they forget to come for this postpartum care. And therefore, a design was made so that they do not forget. And they are able to share reminders so that these people are able to attend these services. And then there you can see the increase. But also in Bangladesh, community volunteers were trained to monitor maternal and child health services in their neighborhood. This grassroots approach empowered local communities to take ownership of their health outcomes and provided accurate real-time data to health managers. The result was a significant improvement in maternal health indicators, such as an increase in antenatal care visits and a reduction in maternal mortality. So, for example, in Uganda, just to borrow from Bangladesh regarding the community volunteers, they have what they call the village health teams, who are trained to monitor the maternal and child health trends within their community. They do mapping of pregnant women around the village and therefore keep reminding them. So when they map how many pregnant women they have in their own village. They even map it by household. And therefore, when they map that in this homestead there is one pregnant teenage mother, here there is another pregnant mother, here there is another one, here there is another one, and there is another one. It is then upon them, because this is a grassroots structure, it's upon this village health team or the community volunteers to remind these individuals to attend family planning services, to attend their antenatal care service visits, and so forth. Remind them of the nutrition trends that they are supposed to take. And we're saying that as a result of this intervention, there is actually a great increase in there. So in Ethiopia, we also had an integrated family health program that trained health extension workers to collect data on family planning, antenatal care, and maternal health services. Now, this data-driven approach allowed the program to track progress over time and adjust interventions as needed. So as an M1E, your work is actually to be the eye. In monitoring and evaluation, you're the eye of the organization, or you are the eye of the program. So similarly, as a reproductive health practitioner, you should not wait for the end of your program. For example, if you're doing if you're a nurse, and or you are a midwife, and you're offering family planning services to your clients, you should not wait for the end of 2 months to be able to come and get your data and collect and submit. You should be tracking your progress every month. If you're tracking progress in a community, you should track for a year. What is your target of in your catchment area? How many women, pregnant women, do you expect in a year? How many of them do you expect at the health facility to seek antenatal care? Then when you're doing, so that when you're offering these services, you're able to track monthly. In a month, how many have come? Cumulatively, you're able to trace, and then at the end of the year, you will even be able to measure whether the target that you had as an organization or as a health team, you track it against what you have achieved. And that is something very huge that you can use in trying to track progress. And then it's important that it acknowledges the importance of monitoring and evaluation in all health programs, but also in all businesses, in all sectors. So what are some of the best practices in reproductive health? Now that we have looked at case studies of how effective M1E applies, you also need to look at the best practices. What are some of the best practices in reproductive health monitoring and evaluation? So to ensure reproductive health programs succeed, it is very essential to implement best practices in M1E. One of the most critical steps is strengthening data systems. One practice that is very critical is strengthening data systems. And we have an example here that, for example, in Ghana, now you have here very many countries that are using the DHIS tool that we discussed the other time very much. That, for example, the adoption of the District Health Information Systems version 2 platform transformed how data is collected and reported. Health officials can now access real-time data on maternal and reproductive health services, which has improved decision-making and resource allocation. So it is important that we strengthen our data systems. We know that we still have very many programs that do not have strong data systems. How data is collected, how data is managed, and how data is analyzed, how data and then is disseminated. Many systems do not have. So the best practice is that you need to have to strengthen your data systems. Have probably how your data bank is. Then another issue is that you need to have capacity building. Capacity building is a very vital aspect in health in M1E, and we're saying that in Malawi, the government adopted this particular practice of capacity building. So they are able to implement training programs for health workers, monitoring and evaluation staff, so that their skills are at par, but also that their skills that are needed to collect, analyze, and report data are enhanced. And this investment in human resource has been noted to significantly improve data quality. And very many of our countries struggle with data quality issues because then the midwife or the nurse that you expect to be the one to collect information, say about patients using a register or using a patient book, the person, if not trained, the health worker will struggle to give you accurate information and therefore become a challenge for you. So when you do this capacity building, you're able to improve the data quality that comes along. And in conclusion, we say monitoring and evaluation are crucial to the success of these health programs. And therefore, it is vital that we use it is vital that we use M1E to be able to give us insights needed to track progress, to improve services, and ultimately save lives. So these modern practices, such as using digital tools, engaging communities, and strengthening data systems, are helping us overcome many challenges in the field of reproductive health. So looking to the future, it's clear that monitoring and evaluation will continue to evolve. The reproductive health landscape is constantly changing, and monitoring and evaluation systems must adapt to new challenges, such as addressing emergency health threats, improving equity in service delivery, and harnessing new technologies. And what the call to action here, or what I am concluding with here, is that M1E practices are not constant. They are not things that will stick, like colors that we have that are no longer evolving. But even colors are starting to evolve. People are mixing blue, green. M1E is not constant, and therefore it will continue to evolve. One is that in the landscape of reproductive health, as it is changing constantly, where we are having different contexts. Initially, if we were talking about reproductive health, we will not bring issues regarding the LGBTQ in there, but we are starting to see some trends going, and we are seeing issues regarding LGBTQ coming in. So as a reproductive health specialist in this era, you should be able to adapt to some of these new challenges and then develop. In other words, you're called to be innovative as an M1E or as someone who has gone through demography and reproductive health, or who has gone through this particular lecture, that you should then be able to innovate and look at things. For example, currently we are looking at climate-related issues. We're talking about climate changes. These are issues that are new fields that are emerging, but you should then be able to look at monitoring and evaluation of these changes, climate changes, and so forth. So the future of reproductive health depends on our ability to monitor and evaluate effectively to ensure that no one is left behind. So that concludes our comprehensive lecture on this particular module. You are encouraged to make effort then to be able to get information and read furthermore. So that is it. Unless we have any questions to what I have presented, but that is actually all that I have to present for today.